When you've made the decision to go on Medicare, the first thing you have to do is get a Medicare card. So in this video, I'm going to show you how and when to do that and how you can get the maximum benefits out of your Medicare card. Today's Medicare cards look just like this. The name of the Medicare beneficiary obviously would be your name. The Medicare number today is 11 digits, some letters, and some numbers. Now for years, Medicare numbers were someone's Social Security number, but because of all the identity theft, they wisely stopped using Social Security numbers for a Medicare claim number. This is a unique number for you for your Medicare purposes. The effective date is always the first day of the month that you begin your Medicare coverage, and this card represents what we refer to as original Medicare, broken up into two parts, A and B. A is called hospital, B is called medical. Now let's talk about getting that Medicare card. So the first thing you have to realize is that the majority of people have to start their Medicare at 65. There is one group that doesn't have to, but those that have to start Medicare would be anyone that is covered by they or their spouse's retiree plan. You have to go on Medicare at 65. Anyone that's covered by COBRA insurance, in other words, they don't have any other option but COBRA, they have to go on Medicare at 65. Anyone covered by an Affordable Care Act plan, you went through the healthcare exchange. Now, technically, you can keep an ACA plan, but the problem is all the benefits financially are gone. The tax subsidies go away. The cost sharing that the government helps you with is going to go away, so there's no reason to keep an ACA plan once you're Medicare eligible. And then thirdly, anyone that is covered by what is called TRICARE for life. This is someone that's retired from the military. They have TRICARE insurance, and once they're Medicare eligible, they have to go on Medicare A and B at 65 because TRICARE for life will only pay second to Medicare. And then anyone that is still working, covered by a group plan of you or your spouses. If that group plan has 19 employees at the company or less, you have to go on Medicare because once we're in a small group, Medicare pays first and the group plan only pays second. So this group of people, all of you, have to start Medicare at 65. So the only people that don't have to start Medicare at 65 are those that they're their spouse, still actively employed, working for a company that has 20 employees or more. This group does not have to go in Medicare A or B. Now you will hear that if you don't take A at 65, you'll be penalized. That's not true. If Medicare A is free for you, you'll never be penalized for that. Free meaning there's no premium you have to pay because you've been paying Medicare taxes, okay? You don't have to take A, you don't have to take B. Now, if you decide to take A only and keep working, that's fine. But remember, if you have a health savings account, an HSA, you can no longer put any new money in the HSA once you've enrolled into Medicare. So if you have an HSA, probably don't want to enroll into Medicare A. And again, you don't have to take B either. You can pick up B at a later date, at 67, 69, whenever, as long as you have credible insurance coverage through an employer provider, you or your spouses, all the way back to 65. We can pick up B at a later date. Now let's talk about how to enroll. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now let's talk about how to enroll into Medicare to get the Medicare card. Okay, first off, there's going to be some of you that will self-enroll, and there's others of you that are going to be automatically enrolled into Medicare. And that would be anybody that is on Social Security or you're receiving retirement board benefits. Anyone on Social Security is automatically enrolled into Medicare, and you'll get your Medicare card about 3 months prior to your 65th birth month. So you'll be automatically enrolled into Medicare A and B. And again, unless you have an employer-provided plan, you or your spouses, where there's 20 or more, you're going to stay enrolled in Medicare A and B. Now, if you have a group plan that's 20 or more and it's better than Medicare, then what you can do is you can have A only, and you can actually decline B and pick up B at a later date when you lose the group plan. All right, so that's those of you that are automatically enrolled because you're on Social Security. Now, those of you that are self-enrolled, you're in that group, you're covered by a retiree plan, a COBRA plan, an ACA plan, a TRICARE, or you have a group plan 19 or less, then you're going to have to self-enroll. The process is very simple. You're going to go to myssa.gov and actually set up an account. That'll take you about 10 minutes to do so. And then once you have that account, then you can actually go online and you can enroll into Medicare A and B, okay? And that will take you probably about maybe 10 minutes to set up the account and maybe another 10 minutes to enroll into A and B. Now keep in mind, if you choose to work with us, we'll help you set all this up, no problem at all. But if you do it yourself, that's what you're going to have to do. So that's what we're going to do if we're going to enroll into Medicare to get the A and B card. All right, so let's talk about when to do this. Now again, if you're on Social Security automatic enroll, but if you're not, you're going to have to self-enroll. We have a 7-month window to self-enroll, and that is called our initial enrollment period. And this is for everyone that has to start Medicare at 65. So let's just suppose that your birthday is 7/15/1958, and you're going on Medicare at 65. So you're eligible 7 months. A and B would be effective July 1st. So we have 3 months before, month of, and then we have 3 months after to enroll. Okay, and so this would be June, May, April. This would be 8, 9, 10. All right, so if I enroll these first 3 months here, my Medicare starts in July. But if I enroll in Medicare in July, they won't start my coverage until August. If I enroll in August, they start me September. September, they start me October. And then if I enroll in October, they'll start me then in November. But if I have to start at 65, this is my opportunity to do it during the 7 months. And again, if you don't have other insurance, you're covered by that COBRA plan, ACA plan, small group, or TRICARE, you need to do it in advance so that your Medicare A and B starts the very first month that you're eligible. Now, once we have our enrollment in Medicare A and B completed, now we're going to have to decide how are we going to use our Medicare A and B. In other words, how can we maximize the benefits off this coverage? And so there are two different systems, two different options available to you to using your Medicare benefits. One of those systems is to stay in original Medicare A and B. Okay. A is everything that's going to be inpatient type services, and B is everything that is going to be outpatient type services. So on the A side, this inpatient, this is going to cover when I go to the hospital. Okay, I would pull out my card, and it's the A system that's going to pay the hospital. All the services that I have at the hospital, nursing services, room and board, all the tests the hospital runs, all covered by Medicare A. In addition to that, I have skilled nursing facility covered by Medicare A. And so here's the rules. Once someone has been in the hospital at least 3 days or longer, then the doctor can put them in skilled nursing for rehab. This would be after a stroke or maybe after a hip replacement. Okay, so the A of Medicare is going to cover that as well. Now on the B side of Medicare, this is everything that's going to be outpatient type services. So this is going to be any kind of like an outpatient procedure. This would be an outpatient surgery, maybe a knee replacement, cataract surgery, maybe a gallbladder removal, something like that. Anything outpatient. This would be including all of our labs, CAT scans, MRIs, all those kind of things are going to be covered through Medicare Part B. Okay. In addition to that, this would also be labs, those kinds of things. In addition, what's going to happen is all the doctors, and this would be all the specialists, okay, that you go to see in their office, or they come to treat you in the hospital. Remember, Medicare B always pays the physicians. That would be primary care doctors, specialists, surgeons, anesthesiologists, your hospitalists that make the rounds of the hospital, ER doctors. All those doctors are going to be paid through the Medicare Part B. And then also what's covered would be what's called durable medical equipment. Durable medical equipment. If someone's diagnosed with sleep apnea, they probably have a CPAP machine. If someone is an insulin-dependent diabetic, they may use an insulin pump. Again, durable medical equipment. Anyone that needs a scooter or a wheelchair or a walker or a bed in their home for medical reasons, that's called durable medical equipment, also going to be covered through Medicare Part B. And then lastly, Medicare Part B also covers preventive services. All right? So this would be your shots, flu shot, pneumonia shot, COVID shots, COVID vaccines, hepatitis B, shingle shots, any immunization that is medically necessary is going to be covered under preventive. So if someone goes in for a preventive, first 12 months we qualify for what's called a welcome to Medicare visit. After that, it's a wellness visit on an annual basis. All right, so those are the items that are going to be covered under Medicare Part B. Now keep in mind, this is one option that you have to use your Medicare benefits. Now I want you to realize that if we go with this option, Medicare doesn't pay anything 100% other than preventive. So all these bills here and those bills right there, there will be a balance of the bill. Medicare's not going to pay 100%. And so what would happen with that balance of the bill, you'd be liable for it if I had A and B only. Most people don't do that. So what most people will do in this system, because of these gaps that exist, they actually will get a supplemental plan. Okay? And I've got a lot of teaching on our channel about supplemental plans, but most people either get a supplemental plan F, which covers all the gaps, 6 of the 6 gaps covered by the F plan. Some people will get a G plan, and that covers 5 of the 6 gaps. It just doesn't cover the B deductible. And then some people get what's called an N plan, and that doesn't cover the B deductible, nor will it cover excess when a doctor adds to the bill. So the whole point is we can actually get supplemental plans or Medigap policies to fill in these gaps. So that's one way that you can use your Medicare. Stay in A and B, get a supplemental plan, you go to the doctor, you go to the hospital, you give them your Medicare A and B card and your supplemental card. And so the bill is filed by the provider, it goes directly to Medicare. Medicare pays first, takes the balance of the bill, sends it over to your supplemental plan, and based upon the one that you bought, that company's going to cover the bills either in full or almost in full. Okay? And so that's one way in which we can use our Medicare benefits. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. The other way we can do this is we can actually enroll into what is called a C plan, also called replacement plans or advantage plans, all right? So when someone does this, they're making the choice to use a private health insurance company to cover these original Medicare A and B benefits. And so this is an alternative to Medicare. These have been out now about 20 years. And so the way this works is you have to be enrolled in A and B, but now Medicare doesn't pay individual bills. What Medicare does is they give a flat dollar amount, about $1,000 a month, to that advantage plan, to that company, $1,000 a month. So you're worth about $12,000 to them. And the rules are they have to actually match the services here, but what they can do is they can price them differently, structure them differently, okay? But this is a way in which you can use your Medicare benefits. You cannot be on both of these at the same time. The only thing that these two items have in common is we got to pay our Part B premium. Right now, that's $164.90 a month. So if I stay in this system, I'm paying the $164.90. If I'm over here, I'm also still paying the $164.90. So over here, we now have a private health insurance company that we would pull out the one card they give to us, that C card, because remember this card, I'm enrolled, but I'm not going to use it. And we'll give the card to the provider, to the doctor, the hospital, wherever you go, and you will pay a copay, and they'll take the balance and send it over to that private health insurance company. All right? And so what happens here is most of the Advantage plans have a 0 premium because now in this system we pay copays, we pay coinsurance as well. Over here, we actually paid a premium to that supplemental company, so we didn't have to pay all these different co-pays and co-insurance, okay? And so over here, we kind of pay as we go. Here, we just simply pay a premium. And so you have to decide which way you want to use your Medicare benefits. Now, just one more note on this. If I take that Advantage plan, what they also do is they include a prescription drug plan and also lots of different perks. Okay, so this is the plan that will give you a little dental benefit, some hearing aids, vision benefit, maybe a gym membership, so they will throw in some different perks with that Advantage plan as well. Over here, we don't have a lot of perks. We have premium insurance for sure, but we don't have a lot of perks, all right? And so this is a pay-as-you-go system, few perks. Here we pay a premium. We don't take on hardly any risk other than we just got to pay our premium to our supplemental company. And then when I stay in this system, then what we do is we actually add a prescription drug plan to this. Over here, it included that as part of the package. All right. Now the big difference, and I'll close out with this: using your Medicare card for the most benefits, you got to realize that when you make this decision as to how you want to use your Medicare benefits, remember the only thing they had in common is you got to pay your Part B. And so if you decide to take an Advantage plan, now you have pre-authorizations. And that simply means that your doctor doesn't have the final say so. You go to the doctor and they recommend a knee replacement or a hip replacement or some kind of surgery or something, then that has to be pre-approved approved by that Advantage company. They have the right to do that. Sometimes they approve them, sometimes they delay the coverage or deny it the coverage, and you don't get that. Over here in this system, you never will have a pre-authorization because if Medicare says they'll cover it and your doctor says you need it, that insurance company supplemental plan has no say-so whatsoever. So again, when you decide to use your Medicare benefits, you're going to have to decide how do you want your insurance to work, all right? Over here, we also have networks of providers, doctors and hospitals that have to be in the network, HMO or the PPO. Over here, we don't have networks at all. Medicare's your network. You can go to any provider, any hospital, any doctor, any special surgeon that actually takes Medicare. Over here, you have to make sure that they take your plan, all right? And so we just want you to get the maximum benefits. You got to decide that. Lastly, I want you to realize that if you take an Advantage plan and you stay on that Advantage plan for 2, 3, 4, 5 years or some period of time, if you ever want to get off of that and go over into this system here, now you have to medically qualify to do that. If I get a supplemental plan when I first go on Medicare, you don't have to medically qualify. That insurance company has to issue the policy. So for those of you that have some health issues, this would probably would be your safer option because you can have that Medicare supplemental plan for the rest of your life. If I go over here in this system, then want to switch, now I'm going to have to go through medical underwriting to get that supplemental plan. So if you have a bad health over here, you may never get one of those supplemental plans. So you have to decide which is going to be best to use your Medicare benefits.